Retired police and firefighters in Ohio are less than 2 weeks away from losing the health insurance program that's been in place for first responders for decades. And tonight, one retiree tells us for him, it's a personal crisis. Thank you for joining us tonight at 6. I'm Colleen Marshall.
I'm Mike Jackson. The Ohio Police and Firefighters Pension Fund has no legal obligation to provide health insurance, although it's been insuring retirees since the fund was created by state lawmakers in 1965. But fund managers tell the health fund it was in danger of depletion and action had to be taken to protect the pension fund.
As we have been reporting, retirees who are over 65 and are Medicare eligible will actually save money. Retirees who are under 65 will get a stipend to purchase private insurance, but they have to do that through one health insurance platform. And retirees like Carrie Ellis say for them, it's no help at all. Chemicals were being mixed to make glue when the Southside Georgia-Pacific plant exploded in 1997, killing a worker, injuring nearly a dozen more, and evacuating nearby neighborhoods for safety. But firefighters, like Battalion Chief Carrie Ellis, spent hours trying to control the flames, breathing in those chemicals.
And I had been on scene probably 3 hours, and we had a meeting in the command post, and the Georgia-Pacific and some of the engineers, chemical engineers, came over and said, hey, by the way, this stuff attacks your kidneys and your liver.
Ellis has no way to know if those chemicals or an accumulation of exposures over his 35 years fighting fires led to what he is living with now, a kidney that functions at barely 10%, and the need for a kidney transplant.
At the function, the percentage that I'm at, it could be any time.
Ellis was already working with doctors at Ohio State University Wexner Medical Center, but under the new health insurance plan for pre-Medicare retirees offered by the Ohio Police and Fire Pension Board, OSU is not in network. He has spent hours seeking help from the healthcare platform contracted by the pension board, a company called Aon.
The first guy that I talked to said, if it's an emergency, they would cover it. He said, but if it's an elective, we won't cover it. And I said, what are you talking about? Nobody has an elective kidney transplant. There's just no such thing.
He's been unable to get written assurance from Aon, his new health insurance provider, Medical Mutual, or anyone else that when it's time for coverage, he'll get it. We've heard from police and fire retirees all over Ohio that their coverage is too limited, too expensive, in some counties not even offered. An individual like Carrie Ellis will get a stipend of $645 a month, but it must be spent on the plans offered through Aon.
No mention that, by the way, there's a limitation to getting the stipend. You have to go with a company that we're hiring that's going to offer you junk policies.
Pension fund spokesman David Graham said in a statement that we continue to work with members with specific questions and life-threatening illnesses and conditions to ensure the best possible solutions. While there's been considerable criticism, both OP&F and Aon have also received hundreds of positive comments from retirees who were satisfied with the process. He also says one reason OP&F selected the transition plan we did is so that our retirees could have licensed advisors help them navigate the process. We're going to have more on that tonight at 11, Mike, but I'm also getting ready, trying to interview and get answers from someone at Aon. They say they do not do interviews and will not provide someone to answer my questions. So next stop, state lawmakers.
That's incredible. Colleen, the firefighters in other counties who are offered stipends, are they also offered opportunities to choose, like that firefighter?
Well, it depends on your zip code. You might live in one zip code neighboring a zip code where they had 4 plans, and you have 2 plans offered. We've heard from firefighters in Madison County who had 1 plan offered. Police officers and firefighters in Tuscarawas County had 0 plans offered. So it depends on where you live, and that's why it's confusing to them. They say, a lot of the firefighters say, just give me the stipend, let me shop, let me find the best plan I can. But that's not possible the way it's set up.
What a challenge.
And we'll have more tonight at 11 as well. We're going to continue to follow this union pension and health plan crisis. Stay with NBC4 on air and online at NBC4i.com for continuing coverage.